everyone, today we wanted to discuss the shoulder joint and some common causes of shoulder pain that we see here in the office. The shoulder joint is the most complex and mobile joint in the human body, allowing for a wide range of motion or flexibility.
It consists of three main bones: the humerus, which is your upper arm, the scapula, which is your shoulder blade, and the clavicle, which is also called the collarbone. These bones are connected by a series of muscles, tendons, and ligaments, including the rotator cuff, which stabilizes the shoulder and allows for various movements. Some other muscles that can play a part in shoulder pain are the pecs, the lats, the traps, and then a lesser known muscle called the serratus anterior.
Some common causes of shoulder pain include rotator cuff injuries, shoulder impingement, frozen shoulder or adhesive capsulitis, bursitis, or a strain or sprain to any of the muscles, ligaments, or tendons in the shoulder.
So the rotator cuff is a group of 4 muscles and tendons that surround the shoulder joint. Injuries to the rotator cuff, such as a tear or tendinitis or tendinosis, can cause significant pain to limit the range of motion. These injuries often result from repetitive overhead activities or acute trauma. Also, did you know that most rotator cuff tears don't require surgery? We see these a lot, and we are able to do a ton here in the office to help people with a rotator cuff injury.
And frozen shoulder is characterized by that stiffness and pain in the shoulder joint, which leads to limited mobility or range of motion. This condition typically progresses through stages of increasing pain and stiffness, followed by gradual improvement. It often affects people aged 40 to 60 and is more common in women and people with certain medical conditions like diabetes or hormonal imbalances.
Shoulder impingement occurs when the tendons of the rotator cuff become compressed or pinched during shoulder movements. This can lead to pain and inflammation, particularly during activities that involve lifting the arm overhead. Impingement is often caused by repetitive motions or structural abnormalities in the shoulder.
And then bursitis is an inflammation of the bursa, or a small fluid-filled sac that cushions the shoulder joint. This condition often results from repetitive motion, prolonged postures, or pressure in the shoulder, leading to pain and swelling. The bursitis is also associated, or can be associated, with other shoulder conditions like rotator cuff injuries.
So a shoulder strain or sprain involves damage or injury to the muscles or ligaments of the shoulder joint. A strain refers to overstretching or tearing of the muscles or tendons, while a sprain involves overstretching or tearing of the ligaments that connect the bones to the muscles. These injuries can result from sudden forceful movements, overuse, or lifting heavy objects improperly.
Shoulder pain is a very common condition that we treat in the office. If you or someone you know is dealing with shoulder pain or have pain that is keeping you from doing the things you love, give us a call at 785-842-7325. Stay tuned next week as we dive deeper into frozen shoulder.